This is Dr. Rohde recording an instructional video on how to prepare, collect, and ship the Saliva Test Kit. This one is for both male and female hormones, and this will come in one box. When you open the box, the following items will be in the box: a shipping label, a small envelope with the saliva collection tube in it, a small paraffin strip, and the order form. What we're going to do is ask you to fill this vial completely full of saliva clear to the top. Normally when we eat food or chew gum, we produce more saliva, but food particles and flavorants and those can interfere with the testing. So we have this small paraffin wax strip. This is literally a small piece of wax. You're going to peel the paper off and throw it away, and then put the wax in your mouth and chew it just like a piece of gum. Its only job is to help you make more saliva so you can easily fill the tube. There are small hash marks on the tube, and you're going to fill this completely full to the top of the vial, and then you're going to cap the vial. One of the most important things on this part is to make sure that you have your name and date of birth filled on the tube. Once the tube is collected, you're going to place it into the envelope. The envelope goes back into the box. Next, we're going to look at the order form. This is very simple to complete. There's a section for name, date of birth, your phone number in case the lab has a question for you on the testing, and then there are a couple of other items for you to answer: when you collected the specimen and when you shipped the specimen, and you're going to mark you kept it refrigerated if you collect it one day and ship it the next. We will have already completed the notations here. Was the specimen collected in New York? Because for the majority of us that won't be an issue. We will have already checked whether it's a post-menopausal hormone panel for females or a male hormone panel. Now, we use the post-menopausal hormone panel for women that are post-menopausal, but also for women that are still cycling. If you're cycling, you would want to collect this on day 20 or 21 of your cycle, and that would give us the most accurate dates for the testing. Post-menopausal women and men don't have any specific timing, and that can be done anytime. The lower portion of the section we will have already completed: bill the physician or clinic if you paid us for the testing. Or if you're Medicare, you would then fill out a Medicare ABN form, which stands for Advanced Beneficiary Notification, that basically tells Medicare that you're willing to pay for it if Medicare does not cover the test, because it considers saliva testing to be experimental. You'll want to include a copy of your Medicare card and, of course, that ABN form. Otherwise, they won't process the results or mail them to us. On the back side of the form are a few simple instructions how to complete the testing, some questions to answer. If you're taking any medications already, you will want to put those in and when you took them. And then, of course, at the bottom are a couple of questions to answer and storage and mailing instructions. You'll want to complete those. When this form is all done, you're going to fold it up. It will go into the box, and you're going to put the envelope with the tube in it into the box. When you're done collecting the specimen, I forgot to mention, take the paraffin strip and spit it out. Please do not put it in the tube, because the lab does not like that. And then once the order form and the test tube are back inside the form, you're going to take the label and attach it right here where it says please attach the UPS mailing label. You're going to tape the box shut and put the label on it, and then you're going to include your return address on the outside of the box. And that really completes the testing. Very straightforward and very simple.